Good morning, this is Ravi Dahiya. We are reviewing an example of I almost cringe at the term, but a botched nose job. I find these cases really sad. We're looking at one here, Jessica Alves, and we can sort of see this metamorphosis from youth to clearly having had multiple procedures. You know, it's a very sort of typical pattern here. Basically what happens is that, you know, if a patient wants a slimmer nose, a more defined tip, they'll get a rhinoplasty. And there are two issues. One is simply that it just takes time to see the results of that surgery. I mean, rhinoplasty can easily take up to a year, sometimes even a little bit longer to see final results. So sometimes there's a bit of being impatient and not waiting for that full result. And the other part of this is that everyone's anatomy is different. Your cartilages, your skin. So not everyone's going to get the same result as you might see online of somebody else's result. Your skin has a certain amount of basically stretch to it, pliability to it. Your cartilages similarly are just anatomically different. So you have to be kind of reasonable with expectations. So in this case, what happens is person's not happy with the result, they get another surgery, and then a third. And each time what happens is those cartilages get trimmed further and further with the hopes that we'll get that smaller tip, that more defined tip. And at a certain point, you pass this sort of critical threshold where there's just no structural integrity. That means it just collapses under its own weight, where you get so much scar tissue that you end up here where the skin just looks, you know, damaged essentially. And sadly, at that point, there is literally no fix. So the key is just to avoid this, be reasonable with expectations. You know, if you get an 80% result, a really good result, and it's not perfect, sometimes that's okay. Obviously, we all want perfect results. As a surgeon, I want perfect results for my patients. But again, everyone's anatomy is different. So there are some limitations. And having, again, 90% of a result is absolutely okay. So hopefully that's helpful. Hopefully that'll keep you out of trouble. Actually, we'll just screen or slide down to this next patient. Similar situation here. There was clearly basically over resection, over aggressive removal of cartilage. In this case in particular, it's the bottom end of the nose was just shortened too much, and oddly the top was not reduced. So it's really, this is unusual. I don't usually see this kind of, for lack of a better term, mishap with a rhinoplasty. I mean, there was just some bad decisions made in terms of where and how much the cartilage was removed. I feel bad for this young woman. So this is where it gets back to, you know, finding a surgeon who does a lot of rhinoplasty, seems very comfortable with the process and can explain the ins and outs, do some computer imaging before and after so you can really understand the process and get a good sense of where he or she may think that they can get your nose. So usually rhinoplasty results are awesome, fantastic. You have the great results for life. But again, part of it is really just finding that right person to do it for you. So hopefully you enjoyed this, learned something. Again, hopefully this will keep you out of trouble. If you have questions, please feel to reach out to our office. If you like the content, certainly subscribe to our channel and like our page. Thank you. Have a great day.